Friends, I am Dr. Ghosh. Welcome to my channel, Dr. Ghosh Presents. Tissue salt therapy part 4 intro. If you are new to tissue salt therapy, viewing part 1 is a must. Please remember, if you know something about tissue salt therapy, then you may not read part 1. But if you are absolutely new and you are starting from this particular part 4 intro, then you should compulsorily read part 1. That is a must. What are the often used potencies in the tissue salt? On the right hand side, below the image of our founder Dr. Schussler, it is written that potency in heavy script are often used. Thereafter star marked and rest are frequently used. Now we just read the chart. In case of calcarea fluorica, in case of calcarea phosphorica, calcarea sulfurica, ferrum phosphorica, that is, in all the medicines, 12 medicines are named serially according to their serial position, and on the right hand side there are potencies. The heavy scripts most often used, star marked, then comes, and others are less frequently used. It is continuing. Number 7, kalium sulfuricum, magnesia phosphoricum, natrum muriaticum, natrum phosphoricum, natrum sulfuricum, and silicea. Is there any laxative or purgative in TST? TST means tissue salt therapy. Of course, tissue salt combinations is right there. That is, tissue salt combination medicines are available in the market, and the combination for purgative or laxative is fixed. It is readily available in the market. Further, if one finds the reasons of constipation, then single salt would also serve the purpose. For example, number 1, if condensation of the bile is the reason, then one of the these two salts, that is natrum phos, salt number 10, and natrum salt, salt number 11, may be required. If there is condensation of biles, that is biles is condensed, so constipation ensues. In this such situation, NP or NS may be required depending on other symptoms. Number 2, if there is want of potassium chloride in the bile, potassium chloride salt, the same may be compensated with calimure, salt number 5, to fight the constipation. That is, in such case you will give simply potassium calimuriaticum. Number 3, again, constipation may result owing to irregular water movement due to want of sodium chloride in the body. In this case, natrum mure, salt number 9, would help us. Number 4, sometimes due to want of sodium phosphate in the salt, in the blood, circular muscles of the intestine fail to contract and constipation may occur. In such case, natrum phos, salt number 10, may tackle the situation. 5, or there may arise want of silica in the system, resulting weakness of the nerve of the intestine, whereupon one may call silicea, salt number 12, to dissolve the situation. Please remember, in such cases, medicines of low potency should be used in quick successions, and patients should be advised to take foods and drinks that facilitate expulsion of excreta. There is foods, particularly fruits, green vegetables, fibrous, any food of fibers, containing fibers, carbohydrate also, fibrous carbohydrate, protein also, there is a dal or pulses actually. So there are so many pulses are there, there contains also fibers. This type of food will help expulsion of excreta easily. How do we fall ill and how tissue salt helps us to recover? We fall ill due to so many reasons. Number one, due to invasion of microbes like bacteria, virus, protozoa, fungi, algae, etc. Number two, due to congenital illness. Number three, due to metabolic disorder. Number four, due to iatrogenic disorder. Iatrogenic disorder means medicines, diseases caused by medicines. Number five, due to allergic disorder. Number six, idiopathic diseases. Idiopathic diseases mean diseases which has got no reasons, no causation, no scientific causation is there. These are called idiopathic diseases. Autoimmune diseases, that is these diseases where our immune system attacks our body tissues and causes disease. These are very difficult to cure diseases. Anyway, there may be others also. So star has been given. When we fall ill, functions of cell in our body change. This happens due to dearth of one or more mineral salts in the cells. The sole objective of a tissue salt therapist is to replenish the want of particular mineral salt or salts and reset the equilibrium of the function of the cell. That is all. Then automatically health will come and disease will go. The abnormal signs and symptoms of the persons are the key for selection of tissue salts, because when we will read tissue salt, that is materia medica of tissue salts, then head to foot on all organs, superficial organ, deep organs, the signs and symptom arises due to want of salts will be discussed thoroughly, and that is called materia medica. That will be discussed first. Then we will take up therapeutics also later on. Therapeutics means according to disease, treatment according to disease. Are here head to foot from salt. Every salt has got some symptom from head to foot. Medicines of which potencies are used for which types of disease? For acute diseases like cough and cold, fever, diarrhea, earache, etc., where symptoms appear suddenly in fierce form, stay a definite period and then disappear, medicines of low potencies such as 3x, 6x, 12x are commonly used. For subacute diseases like subacute endocarditis, subacute sclerosing, panencephalitis, where disease comes gradually, stays weeks or months, generally subacute disease range is 6 weeks to 3 months, then gradually go off. Medicines of medium potencies like 12x, 24x, 30x are generally employed. On the right hand side, I have shown an image of subacute sclerosing panencephalitis. Image means brain, encephalitis means brain tissue. So the first picture, the topmost picture, it is a generalized picture. It is not a real picture. It is some sort of diagrammatic, but this is a real image. MRI, magnetic resonance imaging. Magnetic resonance imaging of subacute sclerosing encephalitis. What will be the type of picture that is shown here? These are the signs that this disease a particular disease has been formed. This white stripes, this one. Which potencies are used for which types of disease is continuing from the pre-page. For chronic and complicated diseases like rheumatoid arthritis, chronic obstructive pulmonary disease, chronic peptic ulcer, psoriasis, Alzheimer's disease, dementia, Parkinson's disease, cystic fibrosis, diabetes, cancer, systemic lupus erythematosus, etc., where diseases generally comes very surreptitiously. Exceptions are there. Stay more than 3 months, sometimes years or lifelong. Medicines of high potency such as 30x, 100x, 200x, as well as other low potencies, depending on situation, are administered. These diseases are very much challenging to tackle with and are the real field to play over by a tissue salt therapist. Of course, in these cases, constitutional homeopathic treatment is often required. Please remember that your tissue salt therapy that you are learning is a marvelous process which can be adopted. Which can be adopted with side by side with any other system of medicines, because these are simply salts. This will not interfere with any other thing or any other medicines. So this system of treatment can be complementary to any therapy in the world running. You may rest assured regarding this. On the right hand side, I have shown three pictures. Number one, on top left side, RA means rheumatoid arthritis. It's a very bad type of arthritis, autoimmune diseases. And then butterfly rash of SLE, systemic lupus erythematosus. Others symptoms of SLE shown in the lower image. With this, this video ends. Thanks for listening and viewing. If you got anything to remark or say or any questions, please write down in the comment section. I will certainly attend.